Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to today's episode, this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today I am going to talk about a few things that have been coming up in my life regarding how we practice, how we teach, how we approach other professionals. And I think it's important as women, especially as lactation consultants or nurses or midwives or physical therapists or dentists or whatever your profession is. And I always feel like when I'm listing professions, I'm going to leave somebody out. So I didn't mean to leave anyone out. All professions are welcome here. And I just want to say that, in the world, we practice interdisciplinary and then we learn things separately. And then we come to practice. And in the world that we practice, we are, what's the word I want to say? We may be intimidated, feeling like we don't belong where we're trying to be. Does that make any sense? So I'm going to get a little bit more specific. But I want to talk about how important it is for us to welcome newer providers and collaborate with and help lift up people who may not know as much as we do, people who may not be as experienced as we are, and recognize that we were once that person, right? So I'm going to tell you about two experiences I had that brought this up for me and why I wanted to share it today. Okay, so little backstory. When I was in nursing school, and I'm going to age myself here, it was in the 80s. And I remember how hard it was and how, for the most part, we didn't help each other. Like we had a group in our own class that we helped each other, But after that, it was kind of like you had to prove yourself. We had this phrase that really is terrible, but that nurses eat their young, meaning instead of nurturing, it was kind of like let's see how they do kind of standoffishness. And it was kind of scary and intimidating, and it didn't make you feel welcome, especially as a new nurse working on the floor. And I was actually taught not to be welcoming to other new nurses. So when I worked, you became a new nurse, and within 3 months, you were the expert on the floor and training the new nurses that came on. That's how fast the turnover was. There was a nursing shortage in the 80s, and it was very, very stressful, and we were way understaffed and way overworked, but we were trained, put in the trenches, and the only way that I survived was there was 2 people that trained me that didn't make me feel uncomfortable. They lifted me up. So I am standing on their shoulders. They gave me the idea of you can do this, right? And I worked, it was a medical floor, and bear with me, this is a long story, but you'll get where it's going. And I had struggles, but I felt supported. Then I transferred to OB. And when I first started working in OB, I faced the same kind of challenges of dog eat dog. Like, oh, sure, you want to work here? Prove it to us. What do you know? And there were 1 or 2 nurses again who brought me under their wing and helped nurture me and helped me feel comfortable in my new role and let me make some mistakes. Nothing dangerous. They watched me practice, because it's all a practice, and taught me how to be a good labor and delivery nurse. Then I had midwives who came, who were amazing, right, that we worked with. And I wanted to be just like them. And then I heard that midwives don't support each other like that. But I was nurtured very well in a midwifery school. I went to Stony Brook. We had a distance learning program. And we felt supported and nurtured, and my preceptor was wonderful, and everything was beautiful. Now, I just come to a place where I just assume that we're going to be supportive to each other. And some of the professional organizations that I belong to, like ICAP, like American Laser Study Club, we have wonderful, supportive networks. Personally, in my life, locally, there's great supportive networks. We refer to each other. We ask each other questions and advice. I run the Tongue Tie Experts Insiders group, where we have amazing conversation about cases. And we just had a case study last night. If anybody's interested in Tongue Tie Experts Insiders, you can find the link in the show notes, or if you're watching me on Instagram or Facebook, just shoot me an email at lisa@lisapaladino.net, or just go to tonguetieexperts.net/insiders. The information is there. It's an interdisciplinary group. So last night was our monthly meetup, and we had a provider who is not in the same role as we are, but she's in our group, and she came and she talked to us about sleep training. So sleep training is controversial in the IBCLC world, but because the tone of our group is accepting and looking for where we can learn from each other, we all learned something, including the person giving the case study and asking for our advice. And I learned something from her, and we learned from other people that were attending, because we have like a roundtable discussion on Zoom. And it was beautiful. And it is in this spirit of collaboration and learning that I want to stay. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much. Now, brings me to why I decided to talk about this today. Because I had a negative experience yesterday in a Facebook group that I will not mention, that it's all lactation consultants or, LCs. It's all lactation based. And somebody asked a question and I answered it, and I literally got attacked by somebody who just was not nice. And I couldn't figure out why. I just could not grasp why this person wasn't being kind to me, even if she didn't agree with me. Because I answered a question that somebody had asked, and she didn't like my answer. So this is going to go a little bit into tongue tie management. The question was about, what do we tell patients to do after tongue tie release? And someone said there is standard about post-release wound care or aftercare. And there isn't. So I said, no, there's no standard. There really isn't. There is not enough research about it. And I said, in my course, I teach. This is one of the ways that we do this. But first of all, we have to be really careful. And this is what I teach in my course. And this is what I say all the time. The surgeon who does the procedure is the one that tells the parents how to treat the wound. It's his or her jurisdiction. It's her thing. She did that procedure. She knows what she needs done with that wound. We don't know, right? I am blessed to collaborate with someone who I know what he wants done. There's two different providers, basically whose releases come to me. And I know what they both do after procedure. And we talk about it. Whenever it changes, we talk to each other and say, no, let's try this. This is what I'm going to tell parents now. And when parents come, I ask them, what did the doctor tell you? What did the dentist tell you? And that's what we do. We don't make up a standard in the office as lactation consultants. That's not in our scope. So I said this, and that's what put her feathers in a ruffle for two reasons. Number one, she misinterpreted what I was saying. She was saying she has a standard in her practice. That's not what I was saying. I was saying there is no standard. Number two, she didn't like the idea that I sell a course. And that was like, wait a minute. She said I was being sneaky, but I wasn't being sneaky because I came right out and said, this is what I teach in my course. Here's my course. I teach courses, right? So I wasn't like, oh, I'm going to tell you a secret, whatever. It was really catty. I didn't mean it to be anything but educational for the original person who asked the question. People jumped on and mostly agreed with what I was saying and backed me up with research that there is no research about aftercare. There is no actual standard. All right. Not that there's no research. There's no definitive answer through the research studies. yet. There is a lot of research underway. There are standards being set up by professional organizations, and there's lots of input being put into studies about this. And we know what works for us, but we cannot say that there is a standard because there's not. So semantics, yes, but important because as people who claim to be tongue tie experts or tongue tie providers or work in this field, we have to be so careful not to get this wrong, not to mislead anyone, to realize that we don't know what we don't know, and to have an open mind and learn from each other. And I think the saddest part of what happened in that Facebook group was that there was a person who didn't answer in a way that helped us learn from each other. It got back around to that, but that ego-centered idea of this is what I said, you don't have the right to say this, that shut down the conversation. So let's be bigger than that. I welcome all professionals, all opinions. We're not going to all agree with each other. It's just the way it is. So let me know what you think about that. The other thing that I learned or wanted to share about today was I did a podcast interview with Dr. Pia Gandhi today that's going to air in a few weeks, maybe a few months, depending on how things go. And we had a wonderful conversation all about this topic of learning from each other. And one of the things that I wanted to bring here today was the fact that as new providers, again, we are sometimes intimidated. We come to a conference maybe or walk into a room of professionals that seem to have everything going for them. They have the whole team set up already and they know other people and they've been doing this for years and their practice is making money and all the things that you aspire to are already going on. And here you are with a new provider, either a new dental provider with a new laser or an IBCLC that's scared to assess for tongue tie because what if you get it wrong? And the message I want to say there is you have to adapt an open mind and a realization that all of us were where you are at one point. And to empower you, that's my goal, to empower you to get the education, but don't wait too long to take the steps to practice because we need you. Mothers and babies need you, whether you are a lactation consultant or a birth professional like a doula or a midwife or an OB or a pediatrician, I should only hope, or someone who works with the body like a physical therapist or a OT or a chiro or a craniosacral provider or a speech language pathologist, we need you to practice. We have a shortage of people who know how to do this right. And if you are having any education, you know more than most people. If you're listening to me and you listen to me and you've taken my courses or you've taken other courses, if you go to lectures about tongue tie, don't sit on it. Get moving. Get local or even virtual help to support you, but do it because mamas and babies need you and we need people who know how to do this right. And my biggest advice for those of you who are starting out is to have a very extensive library of referrals and education material that you feel fits your practice and share, educate. You're not here to tell a parent what to do with their baby. You are here to teach the family in whatever lens you're looking through. You're going to teach the family what you see, what you think is being affected by the lack of adequate tongue function and how that can be improved. Give them the information and let them make decisions. That's our most important role. And you do not have to be experienced to be able to do that. Being an educator is not what we all expected coming into the healthcare field, right? We thought we were going to be people just taking care of the patients. But the education, especially in today's world, is the most important because there are people doing this wrong. There are people who pressure or make families feel pressured into this procedure. Tongue-tie treatment is not necessarily release of ties. There are many ways to make the tongue function other than a frenotomy. All of these things are key when we realize that there are families who are confused because they're getting so much information from all different directions. So have a way to educate your families, your patients, your clients, right? Have education, have referrals, have networks. So if you're not confident and you have a patient, I get this all the time. I had a baby yesterday and this is what I found. Lisa, what do you think I should do? Or who should I send them to? And that's what we do. We say, well, oh, so-and-so sounds like they need a whatever, and go to this person. And it's not always a frenotomy. A lot of times it's tension release or craniosacral. So this also applies to older children. Even though that's not in my scope, we do want to have the same principles of education to older children and adults, right? We want to make education the key. And how do we do that, right? There's lots of ways to do that. We can either make a course ourselves or make education materials or handouts ourselves or look at the professional organizations that exist and see what kinds of materials they have. You may find good YouTube channels or even Instagram channels that are giving out good information, but be really careful. I found this interesting. There was, and I'm not going to mention her name, but there was somebody who was showing people exercises, and she used to be the one whose YouTube channel everybody shared. And I heard her recommended yesterday again. And I had spoken to her a little while ago, and she was like, you know what? I have to take those down because I don't even do that way anymore. So be careful what you're sharing. And because of that, I'm very careful and diligent about updating. Every time I change what I do, I update my parent education materials. And if you are a professional who's looking for handouts to give your patients or downloads, shoot me a message and I'll put it in the show notes as well. I have my education packet that I've honed and tweaked and changed. I just changed it again in the fall, all about all the things that you want to educate your patients about, right? And it's all there, and you can it's for purchase. I'm not going to be ashamed that I sell courses, right? So that was the other thing about that post yesterday. Why shouldn't I sell courses? Why shouldn't I get paid for sharing my information? I give so much away. Look at me giving this information away. Whether you're seeing this on Facebook or Instagram or listening to the podcast, nobody's paying me today. I give away so much that I'm not ashamed that I have to support my family and I have to make some money here and there, right? So anyway, thank you so much for joining me today. I hope this was a little bit helpful. I know it was a little rambly, but I just wanted to come on and talk today because these things were on my mind. And I have a feeling that some of you have similar experiences or have thoughts about this or apprehension about taking that first step forward or knowing, do I know enough to do this work? And I'm here to tell you, you do know enough to start. We all do. If you've taken a course, if you've listened to podcasts like this one or others, or been in conferences with other professionals and you got all the information, you got your laser and you've been to laser training and you know how to be a good medical or dental professional, you are ready to start. So take the first step, always ask questions, always educate your parents and patients, whatever their age is, give the education, support whatever decisions they make, and be there for them. And you will succeed and you will help parents and families and mamas and babies, and you will have a reward beyond the financial. I promise. This work is very rewarding. It's frustrating, but it's very rewarding. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.